Hi, my name is Emily and this is my presentation for Nursing 465 on electronic cigarettes. Smoking rates in the United States have been driven down by health concerns, increasing regulations, higher prices, and changing social norms. Cigarette companies have recognized that smokeless tobacco may be a way to retain profits and customers. E-cigarettes act and feel like real cigarettes. They give a mouth and a taste sensation similar to smoking and deliver a similar amount of nicotine to a cigarette, but do not have the tar and other toxins generated by burning tobacco. The detrimental physiological effects, such as respiratory deterioration, and are decreased compared to smoking and devices that do not generate the same level of secondhand smoke. Therefore, e-cigarettes seem to be an acceptable and safer alternative to cigarette smoking. E-cigarettes contain a battery-powered heating device or atomizer that produces a nicotine vapor for inhalation, triggered by when the pressure drops that occurs when a user inhales from the device. The cartridge contains nicotine and either propylene glycol or glycerol and some sort of flavor. Two online surveys conducted in 2010 using a multivariable model to examine e-cigarette awareness, use, and harm perceptions. The results of these two studies showed 40.2% had heard of e-cigarettes, with awareness highest among current smokers. In both surveys, young, non-Hispanic, white, current smoker, and those with at least a high school diploma were most likely to perceive e-cigarettes as less harmful than regular cigarettes. Awareness of e-cigarettes is high, and use among current and former smokers is evident. The CDC recommends product regulation and careful surveillance to monitor public health impact, emerging utilization patterns, and to ascertain why, how, and under what conditions e-cigarettes are currently being used. Are electronic cigarettes the holy grail of nicotine replacement? Electronic cigarettes are an interesting innovation, a new way to administer vaporized substances to the bronchia, lungs, and bloodstream. This opens two perspectives for smoking cessation and related fields. Electronic cigarettes are increasingly popular. Google searches for this term have increased by 5,000% over the past 2 years. 18% of U.S. smokers have ever used e-cigarettes, and they are probably more satisfied than nicotine medications. They have tobacco flavors, visible inhaled and exhaled vapor. They resemble a cigarette and can deliver high amounts of nicotine. Even e-cigarettes that do not contain nicotine decrease cravings for tobacco withdrawal symptoms and are perceived as helpful for quitting smoking. Using e-cigarettes costs about $1 a day, which is 5 to 7 times cheaper than smoking a pack a day for the same number of puffs, or than using nicotine medications that are recommended by the pharmaceutical industry to help stop smoking. The nicotine inhaler on the left is a device that gives out a small dose of nicotine. When you puff on the nicotine inhaler, nicotine vapor is released from the cartridge inside the device. The nicotine enters the bloodstream as it is absorbed through the lining of the mouth and throat. Hold the vapor in your mouth for a few seconds and blow it out. Do not inhale it in the lungs. The inhaler is available only by prescription. You must use the nicotine inhaler repeatedly throughout the day to control cravings or withdrawal symptoms. The nicotine inhaler may cause cough and mouth or throat irritation. Avoid eating or drinking anything but water for 15 minutes before use or during use to prevent nicotine absorption problems. Electronic cigarettes or e-cigarettes to the right look and feel like regular cigarettes, contain nicotine, and do not require combustion to produce smoke. They offer the freedom to smoke anywhere. Concerns have been raised that the use of electronic cigarettes may be harmful to public health. The smokers have been advised by the U.S. Food and Drug Administration not to use them. While more research is needed on the cost-benefit equation of these products and the appropriate level and type of regulation for them, the harms have tended thus far to be overstated relative to the potential benefits. In particular, concern over repeated inhalation of propylene glycol is not borne out of toxicity studies of the compound. Risk of accidental poisoning is no different than many other household devices and chemicals available in the supermarket. Concerns that e-cigarettes may promote continued smoking by allowing smokers to cope with no-smoking environments is countered by the observation that most smokers use these products when trying to quit smoking. Electronic cigarettes may have their benefits. In one study among 40 smokers who were initially not interested in quitting but were asked to use e-cigarettes as desired, 22.5% achieved sustained smoking abstinence, which was biochemically verified at 6 months follow-up. Furthermore, an additional 12.5% of individuals reduced their smoking by 80%, and 32.5% reduced their smoking by 50%. Several survey studies have supported these findings. Finally, an often unconsidered advantage to e-cigarettes is that they do not require combustion and therefore produce no secondhand smoke exposure to the user or to individuals in the smoker's environment. Secondhand smoke, especially in homes of children, pose a serious public health risk, increasing the incidence of sudden infant death syndrome, respiratory illness, middle ear disease, and asthma. Children aged between 3 and 11 have the highest levels of secondhand smoke exposure. Finally, an often unconsidered advantage of e-cigarettes is that they do not require combustion and therefore produce no secondhand smoke exposure to the user or individuals in the smoker's environment. Secondhand smoke, especially in the homes of children, poses serious public health risk, increasing the incidence of sudden infant death syndrome, respiratory illness, middle ear disease, and asthma. Switching to e-cigarettes has the potential to improve the globe. In addition, their combination of flavorings and the high-tech image that is potentially attractive to youth brought the World Health Organization to recommend that electronic cigarettes be regulated as combination drugs and medical devices. Consistent with this recommendation, several countries, such as Australia, New Zealand, and Canada, restricted or banned electronic nicotine devices until reviewed by regulatory agencies. A 2009 court decision has blocked the FDA from regulating electronic cigarettes as drug delivery devices in the United States, ruling that products containing nicotine derived from tobacco are tobacco products under the 2009 Family Smoking Prevention and Tobacco Control Act unless they are sold as therapeutic aids for cessation. Could e-cigarettes perpetuate addiction? New Zealand is committed to becoming smoke-free by 2025. Advocates fear that far from helping people quit, e-cigarettes will enable smokers to continue their addiction without the discomfort of their enforced abstinence produces, thus reducing incentives to quit. It is currently illegal to sell nicotine or use an e-cigarette in New Zealand. Many users may import up to 3-month supply for personal use via the internet. Lobbying to allow sales here is already underway, and if the smoke-free goals are to be achieved, this must be resisted. The e-cigarette industry would almost certainly be less innovative if it were regulated, but regulation is nevertheless needed to ensure that these products are safe and effective. Research is urgently needed in vitro, in animal models, in clinical and in public health settings to document safety, toxicity, efficacy, and public health impact of these products. E-cigarettes are manufactured and distributed by relatively small companies, not by big pharmaceutical or big tobacco. These companies have little interest in publishing research. They even probably fear that studies may document adverse effects. Thus, there is the need for independent research supported by governments or foundations. Although there are many supporters for e-cigarettes, many individuals in the tobacco control community who would prefer that e-cigarettes be regulated as drug delivery devices or banned entirely from the market. Furthermore, animal studies on repeated propylene glycol vapor exposure indicate no additional effects, and the nicotine inhaler has similar side effects. Finally, their concern regarding the possibility of accidental child poisoning is also something that should be investigated and monitored. Currently, e-cigarette companies label their products with warnings to keep cartridges out of the reach of children. However, it is important to put the concern into context. Many household products are potentially dangerous to children if consumed, yet we do not ban these products. FDA held a press conference in 2010 during which it warned consumers not to use e-cigarettes because of the presence of toxic chemicals, including diethylene glycol and carcinogens. The FDA did not report was that it detected only trace levels of carcinogens, levels similar to that found in the nicotine patch and nicotine gum, and found diethylene glycol in only one of 18 samples tested. Viewed in this context, instead of the warning to consumers not to use e-cigarettes, we would argue that this data suggests that e-cigarettes may pose much lower number of carcinogens than regular cigarettes and are probably similar to the FDA-approved nicotine replacement products. It is recognized that stronger quality control standards need to be utilized by e-cigarette manufacturers to prevent human exposure to toxic chemicals, such as diethylene glycol. The FDA also found diethylene glycol a component of antifreeze and brake fluid, which is classified as a poison by the World Health Organization. High quantities of this can cause kidney damage, nerve dysfunction, and respiratory failure. Cartridges come in various concentrations of nicotine, and refill solutions sometimes contain dangerous amounts of nicotine, up to 720 milligrams of nicotine, which is several times the fatal dose of nicotine. In my research, I have found more flavors available than at a Baskin and Robbins. Marketing to children is more of a gray area. Despite concerns over potentially child-oriented marketing and flavors such as bubblegum and chocolate, research suggests that children under the age of 12 are not using e-cigarettes. Physiological effects while using e-cigarettes do not deliver many more harmful toxins associated with tobacco. Nicotine is not without its dangers. An investigation of physiological effects of e-cigarettes showed that after 5 minutes of inhalation, subjects had significant levels of nicotine and increased resistance in their airways. These effects are similar to those found after acute tobacco smoke inhalation and implies that nicotine has the potential for permanent changes in lung function. E-cigarette use more than doubles among U.S. middle school and high school students from 2011 to 2012, the CD found. Uncertain about the safety, CDC is concerned because young adults and children are beginning to use e-cigarettes, and the product safety is uncertain. Issues include the potential negative impact of nicotine on adolescent brain development, as well as risk for nicotine addiction and initiation of the use of conventional cigarettes and other tobacco products. The FDA does not regulate these products, and few states have restrictions on selling e-cigarettes to minors. Smoking is probably the most important lifestyle issue that practicing nurses have to confront. Smoking is still practiced by 1/5 of the adult population and is responsible for increasing the risk of pulmonary and heart disease. It also has lesser-known effects such as reducing fertility, renal dysfunction, and enhanced GI disorders. The prevalence of smoking has decreased in recent years, largely due to the legislation preventing smoking in public spaces and enhance the antisocial nature of smoking. E-cigarettes are currently banned in Brazil, Norway, and Singapore. Australian and Canadian medicine watchdogs advise against using them. The users cannot smoke them in public in Belgium, Malta, and Slovakia. Will America join them?